Primary care. The National Health Service. The National Health Service and NHS is responsible for healthcare for everyone in the UK, although in a small number choose to pay for private care. Treatment is free, but there's a prescription charge for drugs and appliances, such as cervical collar, with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work with practices of 1 to 20. Practices are based in surgery and look after the health of from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and dying from clinics, give vaccinations, for example, of influenza, and may perform minor surgeries such as removals of warts and moles. If a patient needs a specialist care, the GP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen on appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPs and locum GPs to cover if someone is absent. Note, the practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and fulfilling and scanning documents into patient records. The practice manager has responsibility for finances, sometimes for IT, supervises reception and staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for ones who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients to change dressings, such as user dressings. Health visitors visit families to carry out checkups on young children, particularly under 5s, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment but also teach patients exercises they can do to improve their condition after an accident or operation. At GP's day, Dr. Stewart works in a practice in a small market town with three other family doctors. The surgery is in the center of the town and is chaired by three practices. This is a typical working morning when she is not the duty doctor responsible for emergency and urgent problems. Atención primaria. Servicios de Salud Nacional. Servicio de Salud Nacional, NHS, es responsable por el cuidado de la salud de todo el mundo en UK, en Reino Unido. Aunque hay un pequeño número, que elige pagar por cuidado privado. El tratamiento es gratis, pero hay un cargo por prescripción para medicinas y algunas otras aplicaciones, como un collar cervical, con excepción de algunos pacientes, como niños y ancianos. El cuidado primario es por un proveedor, es provisto por practicantes generales o GPs. También algunas veces conocido como doctores familiares, enfermeras, dentistas, farmacéuticas y ópticos. GPs trabajan en prácticas de 1 a 20. Hay prácticas basadas en cirugía y miran alrededor de la salud de 1,000 a 15,000 personas en su comunidad local. También proveen educación en la salud en áreas como fumar, dietas, corren clínicas, dan vacunas, por ejemplo, para la influenza, y pueden realizar sus cirugías menores, como la remoción de granos. Si un paciente necesita cuidado de especialista, el doctor general va a hacer una orden, va a referir al paciente a un consultante en cuidado secundario. Un paciente es normalmente visto en una basis de citas. Las visitas en hogar son hechas cuando los pacientes están en la casa, son incapaces de dejar sus hogares o están muy enfermos para ir a cirugía. El tratamiento de fuera de horas es de 6 p.m. a 8 a.m. Provisto por el cuidador local primario, que organiza las jornadas de los doctores generales y los locum GPs. Para cubrir si alguien está ausente. El equipo de práctica, un típico doctor en plan recepcionista, ellos son Hay recepcionistas, esos son responsables por el contacto inicial del paciente, hacer citas, hacer solicitudes para repetir prescripciones, tomar mensajes de los pacientes y otros doctores o encargados de la salud. Y para llenar y escanear documentos en los récords del paciente. El manager de práctica tiene la responsabilidad de financiar y algunas veces Cuadro Tecnológico supervisa a los empleadores y contrata a los locums. Estos ayudan a preparar la práctica, el plan de desarrollo de la práctica. Los enfermeros practicantes corren asma, diabetes y enfermedades cardiovasculares, clínicas de eso como tal y clínicas de 1 a 1 para estos que quieren rendirse fumando. En adición, para las personas de la práctica, los doctores trabajan con un número de profesionales de la salud, enfermeras de distrito que visitan temporalmente a los pacientes que no pueden dejar la casa, como también pacientes recientemente dados de alta para cambiar algunos vestimientos como vestimientos de úlceras. Visitadores médicos visitan familias y llevan chequeos para niños jóvenes, particularmente debajo de 5, para asegurarse que estén saludables. La atención especial es pagada para las familias en necesidad, como esos que están viviendo en pobreza, también hacen inmunizaciones para bebés. Las médicas esposas corren clínicas para pacientes antenatales, los fisioterapeutas proveen tratamiento mano a mano para también enseñar a los pacientes a ejercitarse, cómo pueden mejorar su condición después de un accidente o una operación. El día de un doctor practicante, el doctor Stuart trabaja en prácticas en un mercado en la ciudad, un mercado pequeño, con tres otros doctores familiares de cirugías en el centro de la ciudad y es compartido por 3 practicantes. Esa es una típica mañana trabajando cuando el doctor no está en guardia, es responsable por emergencias y problemas urgentes. Complete the sentences. Look at A opposite to help you. Children over 60s and people with some chronic diseases do not have to pay prescription charge in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP practice is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out-of-hours treatment. Make word combination using a word or phrase from each box. One word can be used twice. Look at A and B and opposite to help you. Change dressing, make appointments, perform a minor surgery, refer a patient, run a clinic, supervise messages, take messages. Which member of the practice team will be responsible for each of the following? Look at the opposite to help you. Running a clinic for pregnant women, midwives, teaching a patient how to strengthen his broken leg. Physiotherapist, letting the GP know that a patient can come to her appointment. Receptionist, running a clinic for people who want to lose weight. Physiotherapist, visiting a patient who has just returned home after a hernia operation. District nurses, carrying out checkups on children in a poor neighborhood. Health visitors, organizing cover for an absent doctor. Practice manager, complete the diary for doctors towards afternoon. Look at the AC opposite to help you. 1 to 2 p.m. Practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon surgery. 12 10-minute practices. 4 to 4:20 p.m. coffee break. 4:20 to 5. Check receptionist messages, they will home visits and repeat appointments requests. 5 to 6 p.m. paperwork required the secondary care. Admin task, telephone calls to patients, private medical examinations. 6 p.m. phone switch to out-of-hours services. Medical education. Medical education in the UK. Undergraduate education for 5 years of medical school. This section of a university is responsible for medical education, a 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPs or consultants. Senior specialists often delivered through colleges for different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars, which doctors undertake throughout their working life to keep up to date. The extract from undergraduate prospectus, the MBCHB Bachelor of Medicine, Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integrated program of clinical scientific topics mainly presented through problem-based learning, PBL, where you work with others on a series of case problems, and student-selected models. Student-selected models allow you to choose from many of subjects such as sports medicine or even study of languages preparation for an overseas selective. An hospital attachment, your choice between years 4 and 5. Vocational studies and clinical skills. This component prepares you for the clinical skills required for the contact with patients from year 1 of your course, through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments used 4 to 5, a series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics, and gynecology and general practice. Students view. Helena, medical student, describe her course. I'm just finishing my first year of medicine. What I like about this is the course is that you're involved with patients from the very beginning. Even on our first year, we spend time in a hospital. Most of the course is PBL. We have 2-hour sessions a week where we work in groups of 8 up to 10, solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students have lectures with the whole class, taking notes from lecturers from 9 to 5, but now it's mainly group work. Although we do have some lectures and seminars where we work in small groups with a tutor, I like all of it, even the dissection when we get to cut up cadavers from the second months of the course. Educación médica en Reino Unido. Educación médica en Reino Unido cubre educación de bajo de graduados, 4 o 5 años en la escuela médica, la sección de la universidad responsable por educación médica, 2 años del programa de fundación que provee entrenamiento para nuevos doctores después de la graduación, a través de una serie de colocamientos en diferentes especialidades, entrenamiento posgraduado, cuál es para los doctores para que se vuelvan doctores generales o consultantes, especialistas senior, muy frecuentemente entregado a través del colegio de universidades para diferentes especialidades. Por ejemplo, el Colegio Real de Doctores, con desarrollo continuo profesionales en forma de cursos y seminarios en los cuales los doctores siguen a través de sus vidas laborales para mantenerse actualizados. Extracto de prospectos antes de graduarse. El grado de medicina, grado de cirugía es un 5, el MBCHB es un curso para graduados que dura 5 años. La mayoría de los aprendizajes toman lugares en grupos pequeños. Los componentes principales son el core del año 1 a 3, es un programa integrado con temas clínicos y científicos, principalmente presentados a través de problemas basados en problemas, aprendizaje basados en problemas, donde trabaja con otros en una serie de casos de problemas, módulos seleccionados para el estudiante, permite elegir un menú de materias como medicina deportiva, incluso el estudio de un lenguaje para preparación para una electiva extranjera, una inclusión hospitalaria de su propia elección entre los años 4 y 5, habilidades vocacionales y clínicas. Este componente prepara para las habilidades clínicas requeridas para el contacto con pacientes del año 1 del curso a través de periodos de práctica donde está atado al departamento del hospital o prácticas generales. El tratamiento clínico en medicina, obstétrica, ginecólogo, práctica general.